Welcome everyone to this DataCite member panel, where we feature 3 stories and use cases from DataCite community members. I am Maria Levchenko. I'm a community specialist at DataCite, and I'm going to be the moderator for this session. I'll be joined today by Bessem Aamira from University National Center of Scientific and Technical Documentation in Tunisia, which is a consortium organization within the Tunisian DataCite DOI Consortium. Danielle Boyce from ALS Therapy Development Institute in the US, a direct member of DataCite, and Felipe Arróspide from Chilean Institute for Disaster Resilience in Chile, who is also a direct DataCite member. Today, I'll give a very brief overview of DataCite, followed by presentations from Bessem, Danielle, and Felipe. And as I mentioned, we'll have a discussion and Q&A at the end. If you're not yet familiar with who we are, DataCite is a global community of research organizations that shares a common interest to ensure that research outputs and resources are openly available and connected so that their reuse can advance knowledge across and between disciplines now and in the future. DataCite is a nonprofit organization registered in Germany since 2009. Among our members, we count over 1,700 organizations, including universities, colleges, libraries, museums, archives, and research centers, and our members are spread across 66 different countries. Up to date, we have registered 105 million DOIs together with our members and have supported over 600 million resolutions in 2025 alone. We support our members in achieving our shared vision of advancing knowledge through creation and management of persistent identifiers, the DataCite DOIs, that are associated with rich metadata for diverse research outputs. But DataCite DOI is more than DOI registration agency. We support service integration to improve and enhance workflows and also facilitate discovery and reuse of various research resources that our members register with us. We highlight many benefits of registering DataCite DOIs. When you join us, you promote open research practices as outlined by UNESCO recommendations in open science, and also align your research outputs with fair data principles. You can connect research outputs and resources with the global ecosystem, including the ecosystem of other persistent identifiers such as ORCIDs and ROR-IDs. And you improve visibility and discoverability of these outputs and increase their recognition. Finally, you can boost citations and as such increase the overall institutional impact. If you're interested in joining our community, you can take one of the following routes highlighted on the slide. As an institution, you can join us as a direct member to register DOIs for your research outputs. Or you can join an existing consortium in your country. A consortium is a group of institutions that jointly participate in DataCite governance and activities and use services, and you can form a new consortium with other organizations, for example, at a national or disciplinary level. If you believe in our mission and want to collaborate with us and participate in our governance, you can join us as a supporting member. And finally, if you're developing or working with repository software, you can register us as a registered service provider. So without further ado, I invite our presenters, first Bessem, to join and talk about their use cases as a DataCite member. Bessem, you're muted. Could you perhaps just come off mute?
Sorry for that. Thank you, Maria. Good evening, everyone. I'm Bessem Aamira, Seniority Engineer at National University Center for Scientific and Technical Documentation in Tunisia. Thank you for the opportunity to share our progress today. I will present how the Tunisian DOI Consortium is advancing open science by connecting our national research output to the global DataCite infrastructure, enhancing both visibility and accessibility. Let's begin with a quick overview of how this initiative started. The initiative was launched with support from DataCite's Global Access Fund, which empowers projects to make research more discoverable. In Tunisia, we are aligning with the UNESCO recommendation on open science by adopting persistent identifiers, especially DOIs, as a core infrastructure to ensure our research is fair, led by our center. The consortium offer localized non-profit service to academic institutions, enabling them to assign DOIs to digital research outputs. Our goal is to build a sustainable national community that strengthens the visibility, interoperability, and impact of Tunisian science through open infrastructure. We are proud to announce that Tunisia DOI Consortium has grown to include now 7K members, representing over more than 19 higher education institutions and research centers across the country. Beyond the universities, we are pleased to have a dedicated member representing scholarly societies. These societies, often operating with limited resources, deliver remarkable impact in their fields, and their commitment to our consortium is invaluable. We are so delighted to welcome agriculture-focused sectoral research networks, expanding the reach of persistent identifiers across diverse scientific domains and interdisciplinary collaboration. We deeply appreciate the support and dedication for all current members. We are embraced this newly established consortium. Their early adoption and active participation are crucial to our success, and we look ahead eagerly anticipate welcoming more institutions to amplify our collective voice in promoting persistent identifiers and fostering a thriving open science ecosystem in Tunisia. Since the third quarter of 2024, our consortium has made remarkable progress, registering over more than 3,500 DOIs across 13 active repositories. Notably, 8 of these repositories are already integrated under our 2025 consortium membership, reflecting strong institutional engagement. The majority of DOIs are assigned to doctoral dissertation, showcasing the productivity of our higher education sector. We are also seeing a steady rise in journal articles and reports. This result is a clear sign of growing adoption and underscore the tangible impact of our efforts in embedding DOIs into Tunisia research ecosystem. We've made strong progress integrating repositories with the DataCite infrastructure via their API. For e-journals, we implement DOI registration through the OGS plugin, enabling automated workflows. For other platforms not using OGS, we prepared the metadata and applied XSLT transformation to align with the DataCite schema. In our repository, piece.tn, we curate and validate both published and unpublished research output before assigning DOIs, ensuring full metadata compliance. And let's now take a closer look at how this workflow is done. The following summary outline our systemic approach to manage Tunisian digital research output. with a strong emphasis on automation and adheres to DataCite metadata schema. We are also, our priority is to automate processing as much as possible, particularly in the crucial step of assigning and registration DOIs. We achieve these through the DataCite API, most of them. So this slide presents a screenshot for our digital repository, pieces.tn, and some e-journal illustrating how we integrate DOIs into the resource landing pages. The landing pages include essential metadata about the resource and a link to the full text, helping users confirm they have found the correct resource and providing context for its use. And it's very important to notice that it's also machine readable to enhance visibility and accessibility. As a national documentation center, metadata is a paramount importance to our mission. We believe in the power of well-structured information to enhance visibility, accessibility, and long-term preservation. In this context, our collaboration with DataCite and their robust metadata schema is crucial. This slide illustrates the power of DataCite and their metadata schema in connecting to every facet of the research ecosystem. And at the center, we have the research output itself. At the center of this schema, the research output is in the center and are the core element that aim to identify and track. Research output is connected to related research outputs, also via related identifier property. This highlights how DataCite enables the linking of scholarly materials, fostering a more comprehensive view of research. And we have researchers identified through persistent name identifiers like ORCID ID. These allow us to accurately attribute work and track individual contribution. And in line with our commitment to rich interoperable metadata, we now plan to enhance our DataCite record by linking research output to researchers via ORCID IDs, a key step toward building a connected and trusted scholarly ecosystem. To support this, the Tunisian DU Consortium has officially expanded to include ORCID identifiers, thanks to a strategic collaboration with Itrend. We are proud to announce that CNUTS has joined the newly launched the Regional ORCID Consortium, led by Itrend, officially inaugurated in early November 2025. So also DataCite schema connected research organization and with the metadata. So these institutions are also crucial, and DataCite facilitate their identification through affiliation identifiers like RORID. These allow us to understand the institutional context of research. We also see research funders often identified through Crossref funder registry. The funding reference property links the research output to its financial support, enhancing transparency and accountability. So in this side, to further strengthen the metadata quality, we are now taking another steps by integrating RORID. As a part of this effort, we are actively supporting the registration of ROR ID for Tunisian institution and preparing for bulk inclusion by collecting and normalizing data from universities and research centers. Our strategic goal is to ensure full interoperability between DataCite, ORCID, and ROR, creating a robust, interconnected infrastructure that enhances the global visibility of Tunisian research institutions. This screenshot taken from the Fabrica DataCite web interface provide a closer look at the metadata properties we meticulously fill when assigning a DOI through our digital repository or other e-journals platform. So by including this organizational PID directly within the DataCite metadata, we create a robust and machine-readable link between the research output and the affiliated institution. This practice enhance the discoverability and interoperability of our research output. And also it allows systems and services to accurately identify and aggregate research originating from specific organization, further solidifying the connection we've been discussing. So as a practical exercise to witness this connection in actions, DataCite Commons, a tool developed and openly provided by DataCite, offer a powerful platform to explore these previously established relationships and see a concrete use case. So this we have the possibility to explore works and people and organization and all the repository covered by DataCite. So you can see in this slide concretely by using DataCite Commons tools how showcase the visibility of several Tunisian universities that have not yet taken the step of adopting DOIs for their research outputs or joining our consortium. Unfortunately, despite their significant effort in scientific research, their output remains largely invisible and disconnected with open science infrastructure like DataCite Commons. And building on our exploration of DataCite Commons, let's look at how this metadata connection come to life in the Tunisian context. Here, we see a search under the repositories tab for peace.tn, our national scientific and technical information portal, alongside two e-journals, Journal de l'information médicale de Sfax and Recherche Universitaire, also appear each with registered DOIs. On the left, the University of Sfax profile is displayed linked via its ROR ID. All affiliated repositories contribute to the university total research output, which is automatically updated over time. This example shows how interconnected metadata via DOIs, ORCID ID, and ROR transform abstract data into searchable, transparent, and accessible research pathways. Through the site Commons Consortium gain a powerful lens to analyze and understand national research output. By aggregating DOIs across institutions, we can generate detailed insights by content type, license, repository, and more, offering a real-time dashboard for open access adoption. This unified view supports evidence-based policy evaluation and enables metadata reuse for advanced analytic, including data science and AI application. And new, starting from November of the 1st November 2025, OpenAlex officially integrate DataCite records into its system. This means whether you use the OpenAlex API snapshot or user interface, DataCite metadata will be seamlessly included. This integration brings over 100 million DataCite DOIs into OpenAlex, covering diverse research outputs. For DataCite members, this is major milestone. Any DOI registered through DataCite will now appear in OpenAlex, making research output more visible globally. for research community, it's provide a more completely picture of research landscape, openly available, and strengthen interoperability of the open scholarly system.
Bessem, if I just may point you to the time.
Okay, that's the final slide. So finally, the slide outlines key objective within our border action plan to embrace the FAIR principles for Tunisia research outputs. We firmly believe that adoption, rich metadata, and persistent identifier are fundamental pillars in effectively implementing these FAIR principles, and we are confident with DataCite open science infrastructure facilitated reaching these objectives as we demonstrate below. It's not just technical details, they are foundational elements for enhancing the impact, transparency, and usability of our nation's scientific and scholarly contribution. And to deliver deeper into our activity and achievements, you will find links to various resources to explore at your convenience. So thank you. That's all from me.
Thank you very much. That was really insightful. And I remind everyone that you can put your questions into the Q&A. If you, Danielle, if you could please come on next, and we're excited to hear what you've got to share.
Absolutely. Hello, everyone. I'm Danielle Boyce. I'm principal investigator. Here we go. Real world evidence. You can see my slides. I'm principal investigator real world evidence at ALS Therapy Development Institute. Bessem, that was a great presentation, and I'm glad that you covered some of the more technical aspects of generating the DOIs because I'm not going to cover that today. I'm going to talk to you a little bit more about our use case and why we joined DataCite and how we use the DataCite services broadly, and then some of the challenges that DataCite helps us to address. So at ALS Therapy Development Institute, our mission is to discover and invent treatments for everyone with ALS. We are the first ever biotech in ALS, so I should define that. Amyotrophic lateral sclerosis is a form of motor neuron disease. You might know it as motor neuron disease where you are. ALS is a deadly condition with no known cure or cures, because we believe there's probably more than one cause of and subtype of ALS. It's still poorly understood after many, many years since it was first described. And the lifespan for someone who is diagnosed with ALS is typically around 18 months to 5 years from diagnosis. So you can appreciate the urgency. Our nonprofit biotech was founded in 1999 by the Haywood family. A member of their family had ALS, and they created this nonprofit biotech to try to find a cure. We are the most comprehensive drug discovery lab in the world focused solely on ALS. So we have an entire lab that I don't work in directly, but we have drug discovery, we have biological data, and I'll tell you a little bit about how that works in a minute. So the ARC study is a study. The ALS Research Collaborative is a long-running natural history study. It's a little over 10 years old now. Anyone with ALS or asymptomatic gene carriers, meaning people who may know that they have ALS that runs in their family. Some families have 50, 60 members over time with ALS. If you know that you have it in your family and that you are positive for some of the known genes that cause or contribute to ALS, you can join our study as well. All of our data can be submitted from home, and so you don't have to go through a clinician, and that allows us to have people who live in rural and remote areas participate when otherwise they might not be able to participate in a study at an ALS clinic. We will send a phlebotomist to do a blood draw to your home. And we have a participant portal where you can monitor your own disease progression data, and you can share it with your clinician if you choose. So the ARC, the ALS Research Collaborative, has two different components. We have the study itself, where we gather comprehensive data from people with ALS. And then we have the ARC Data Commons, which we opened a few years ago. We share the de-identified data with researchers around the world. And so that is where DataCite came in, because when I joined the team at ALS TDI a little over a year ago, I was so impressed with what they were doing. I teach at Johns Hopkins in the informatics group, and I've been working in academia for more than 20 years. And so I understand the value of this incredible repository, but at the same time, I wanted to make sure that we were doing things the way that are fair, following fair principles, and in the way that I've kind of taken for granted in academia, we are able to do, which is things like generating DOIs and having our data shared and tracked and findable. And so just to get a sense of the data that we have in the ARC study, this is an actual screenshot of the participant portal, which is very friendly. So we collect a lot of different kinds of data. We have nearly 2,000 participants, about 1,800, but this just rapidly grows every month. So personal background, that we collect samples, as I mentioned, so we can track all of that through our portal. We now collect electronic health records, which I'll talk to you about in a minute. ALS FRSR is the most commonly used outcome measure in ALS clinical trials. And it's like a survey. And so it's a very important measure to capture for people interested in understanding people who progress slowly versus quickly, which we believe feed into this whole notion of the different subtypes of ALS. We also are very interested in digital biomarkers. And so the ALS FRSR, while it documents progression, it is very imperfect, let's put it that way. And we would really like a more objective measure, since people with ALS often lose their ability to speak. There is a good amount of evidence, some of it coming out of our group, that if you record your speech over time, and analyze it, there is a way to predict your progression in a way that is comparable, if not better, than the ALS FRSR, and that could be very valuable in clinical trials. We also document whole genome sequencing here in the portal. And likewise to the speech tracking, we have movement tracking. So we send folks home with accelerometer devices, and they do different exercises and follow a protocol to track their movement. And like the speech tracking, we're hoping to develop digital biomarkers that could be used in clinical trials. So again, we have electronic health records starting 2023. And so far we have about 140 individuals who have donated their EHR data, which come in as FHIR, Fast Healthcare Interoperability Resources. And we parse all of those out. Sometimes it's 20,000 documents that come into us, and we just do it. We process all of those and pull out the meaningful data. And so you can see here, someone is diagnosed with ALS here in the middle. We call that 0 months. And if in the old way, when they were just filling out the surveys before we had EHR, maybe they'd find us at about 6 months after diagnosis, and we would have data after that, lots and lots of data. But now with the electronic health record data, we're capturing all kinds of meaningful information potentially about disease progression, other conditions, medications, hospitalizations, surgeries, and all kinds of things that are contributing to our understanding of what might be the triggers for ALS for some individuals. And so it makes for a really huge and wonderful data set, which we want to share with the world for free. And so enter DataCite. So we have this ARC Data Commons. This is a Google Looker platform. And so investigators can apply, a simple process to apply to be able to access our data commons. And as part of the data use agreement, we want to be able to ask them to not only mention us in a citation, but also the DOI for this. We want people to be able to find us, and we want to spread the word about the data and also track where all of the successes are coming from. And you can come to this data commons and do cohort discovery and all these visualizations, but very importantly, you can also download all the raw data. And so you can analyze it on your own. In addition to that, we have a partnership. We have a lot of partnerships in different groups and things, including I have DataCite here. We're so excited to join. But on the left here, ALS TDI and Answer ALS, we were funded by Microsoft to combine our data, to harmonize it to the Observational Medical Outcomes Partnership, or OMOP Common Data Model, which is my area of expertise. We harmonize the data to that, and then we put it on a platform with them, and integrated our biological data like genomics and proteomics and such. And so that is all on a platform. And then there's a data use agreement that's combined. And again, we wanted to be able to put a DOI on that and on all of our papers related to it, and basically develop a system for being able to track this with DataCite. And so we successfully, see here, we successfully, with all the help from DataCite, it was wonderful and easier than I thought it would be. And I was so proud that we did this. We've been able to do that. And so we've been able to update, here you can see this is our data commons site, and we've been able to add this to our DUA data use agreement. And so people can start using that when they publish and share about it. And as part of this, we've been developing a plan. We've only done 2 DOIs so far with DataCite, but we're making a plan for what we're going to put DOIs on, and how this is going to kind of cascade from here, because we have the DOI, but then there's sub projects under it. And so we're making a plan for doing that. We have other studies that we add, kind of sub studies. And so how are we going to do all of that? But the plan is to do that. We have a lot of non-published artifacts and resources. So for example, this is our real world evidence. It's made for MK Docs. It's a GitHub page. And we have this white paper on Stardust, which is an approach that we developed for launching a observational research study in ALS or anything really. And so we made a DOI for this, so that even though it's not published in a journal, we have a DOI for it. And so likewise, this is Pat Dolan. Pat is an expert at mapping GIS, and he used to work for Esri, the company that makes ArcGIS software, which is the biggest GIS software that we have in the world, probably. And so we are working with him. Pat has ALS, but he makes maps with his eyes using eye gaze technology, and he's a very valuable team member. And so one of the things that Pat helps us do is make maps. And this is a map of the drive time of our participants from their clinic, and we map environmental data as well, like public use environmental data, because environmental causes might be contributing to the development of ALS. And so like Superfund sites and contaminants and pollutants and things. So we have these map layers. And so anyone who has their data set can take our map layers that we made and then apply them. And so we're strategizing around, making DOIs for that, so people can find them and we can track how they're used. Likewise, we have this Train the Trainer program that we've developed around Odyssey and OMOP, which is the common data model that I told you about. And so that would be a good use of DataCite as well. And so this is all part of our plan. We have a guide to real world data for clinical research that we are adapting from this other book that I helped to author with Dr. Goriaco from Montefiore. And so again, this is another opportunity that, that we see to make our resources more findable, and have other groups like in epilepsy and, other disease areas, cancer, oncology, be able to use our tools as well. So thank you again very much for having me, and I'd be happy to take any questions.
Thank you so much, Danielle. That was really insightful and very interesting to learn about your plans. Felipe, you're on next, and I remind everyone that if you have any questions, to please use the Q&A function, and we'll get to them in just a minute.
Okay, can you hear me? Just testing.
Absolutely.
Okay, thank you so much for the invitation, for having me here. Well, my name is Felipe. Now I'll present my slides. Just give me 1 second. There we go. Okay, I think I got it. So yes, good morning, good afternoon, or good evening from which part of the world you're joining us. Thank you again for your time and for the willing of being here and sharing all of these great initiatives and projects that you're working on. I'll present myself. My name is Felipe. I'm from Chile, and I represent the Chilean Institute for Disaster Resilience. We're a very young organization. We are 6 years old. We come from like a startup schema, and we well, I'll show you in a bit exactly what we do. But we're a very young organization. We're a small group that are trying to increase the resilience of our country towards against disaster risk. So in this presentation, we'll talk about a little bit about us, what we do. We're completely different from the previous two presenters. Why we joined DataCite, our main motivations for joining this community, and how we utilize DataCite services, and the challenges, the main challenges we have that DataCite might help us address. So about us, just a quick look about me. I'm a civil engineer from Chile. I'm a hydrologist. I study the water cycle, and you might find strange to find me here and what I'm doing here, but I have been working towards understanding flood risk. This is a very new topic here in Chile. I mean, we have a lot of floods, but flood modeling is something quite new. So in our institute, we're aiming towards every natural hazard that might occur, but we're starting with the most important in Chile, which is earthquakes. And I'm pretty sure that if you know something about Chile, because we have a very seismic active country. So what do we do as an institution? Well, as I told you, we are the Chilean Institute for Disaster Resilience. We call it Itrend. That's for short. I don't know if it's pronounced Itrend or Itrend. I don't know the rule, but I'll just call it Itrend. We're a technological public institute. That's our legal figure. So our mission is to lead Chile towards a greater disaster resilience by creating goods and services of public interest, mainly based on digital technologies and collaboration with different stakeholders from the public sector, industry, academia, and civil society. As you can see on the first graph from the left, on the left-hand side, you have this, which are the phases of the risk disaster or the risk cycle, right? So we start at on the left with a normal condition, and then something happens, right? And you have this disruptive phase where all your functionality goes down, right? And then you start going up again, right? And when you start the recovery phase, and then the restoration. So we are trying to mainly to act on the before the disaster happens, right? So we are mainly a preventive organization that tries to be a strategic partner of the state, as shown on the graph on the right-hand side. We try to be a technical ally. Our state, our public institutions are very lacking on technological resources or on manpower to understand risk disaster. So we, as a technological institute, we're trying to be a technical ally for the state mainly, but we also, of course, do some work for the private sector, but we are mainly focused on working with the state agencies, and our solutions are mainly based on technology, data, and models, which is why this has a relationship with DataCite. So this is our team. I'm not there because before I joined. So what do we do? Just a quick look. This is what you can see here is a risk analysis on the productive sector, like lumber plants and mills. And this is you have 3 maps showing earthquake risk, forest fire, wildfires risk, and on the right you have flood. So all of the tech solutions that we have, we work with web applications for alerts, for alert systems. So when a fire goes out, right, the technical institute will raise an alert and will show up on your mobile or your desktop computer. We also work on education. As you can see, we have these little cartoons that try to educate from the start, right? From the beginning, from our toddlers and our children, right? And at school, we try to teach, right, how disasters work in our country, especially in this territory. We teach about earthquakes, we teach about floodings, we teach about volcanic activity. We try to teach our children, right, our youth, to be prepared and to be resilient. Okay, so moving on. Our main project or our main connection to DataCite, right, is our web platform for resilience data. This is a website that you can visit. There you have on the first link from the top to bottom, you have our link to the website. So it's a free website that you have free access to standardized and systemized data to promote research and apply studies on disaster risk resilience. It's mainly focused on risk and resilience. It's an open access tool. It's a software based on the Dataverse project. So it has this very structured formatting, right? These standards to host the data. And we have the DOIs to every data set published, right, via DataCite. So as you can see on the second screenshot, you have this like widgets where the collection of data is hosted, and each one of these items will have a DOI, right? And it will take you to the landing page of the metadata of the dataset, and then you can access, you can download it. So as you can see, for example, we have this map that they want to publish, okay, or maybe you want to make a manual or a technical document, and people might ask you, okay, where did you get it, or how can I access to it? And we try to close this gap by using DataCite and the DOIs. So whenever you publish a manual or an instruction or a map, right, you put the DOI, so the authorities or the public institutions can quickly access it and know where it came from. So not every data set is probably referenced. If you visit, I don't know, our public websites from government institutions, they just upload data and they make it easy for you to just download it. But if you want to know where it came from, when the data was created, who created it, using what, right? So we take care of that. We close that gap by consolidating every data set that we can get our hands on, and we republish it on our catalog, and we assign a DOI thanks to DataCite to make it more accessible. So that's where our platform comes in. So this is a more detailed screenshot. We immediately we highlight the importance of having a DOI, and as you can see, every data set has one DOI, so everyone that visits our website can access these data sets, right? We use the API to publish many, multiple data sets, as our first guest just showed as well. So as you can see here, and in our, let me see, I have to click, okay. So as you can see on the video, on the capture, the DOI will take you to the landing page of the dataset, right? And then you can copy the link, or you can cite it with using, for example, RefWorks or BibTeX, right? And you have the metadata right there, and every DOI will take you to the exact same structure. And then you can download the data as a CSV, as an Excel file, or TXT, or if it's georeferenced, you can download on like a shapefile or geopackage, and you can use our Python API to download everything you need. So this comes very useful if you want to work on a risk model, or you want to create a risk map, or in the case of our public institutions, you need to create emergency and evacuation plans, which are mandatory by law. So we give a tool, a very useful tool to these organizations, so they can create their own maps or their own data sets using what we provide here on our platform. So what is the main challenge? I mentioned it briefly before, but many of the government official websites, they create and host data, but unfortunately, they focus on the content, but not on the details or the traceability or the accountability of the data. Despite that you know that it comes from a public institution, you don't have a precise account on when it was made, how it was made, and which standard it's following. So our main challenge, and what we're trying to do from the beginning, right, and our main goal from the years to come is to reach out to as many institutions as we can. What you see on the logos on the right of your screen are some of the main institutions that create data, whether it's time series or georeference data, and we are trying to close down agreements or contracts or collaboration agreements to get our hands on this data and standardize it, to have it on a common format, consolidate this data, and provide the DOI so they can, for example, if they would like to publish it on a paper or on a technical manual or in a law, it will be accessible via DOI, which is something that they currently do not have. So right now we have, if I'm correct, like 150 data sets that are referenced via a DOI each one. And our challenge is to scale up and our services and scale up the amount of data set that we can host and offer our services for national or international organizations or institutions that want to collaborate with us. So as you can see, for example, the first two figures that you have at the center of your screen, these are screenshots of public institutions that are publishing data. And as you can see, they just put the button to download. And what we're trying to aim for is what you have on your right, which is taken from our website, where you have the DOI, you have the metadata, so you can have a fair, accessible, right, interoperable, and I don't remember what the RS, but you can follow the FAIR principles, right, to find this data. So the challenge is to reach out and as many institutions and people that we can go for and offer to host these data sets. So if you want to collaborate with us, if you have any data set or you work with risk or resilience data, we invite you to talk to us. So thank you very much.
Thank you so much, Felipe. That was really impressive. And oh my, what a spread today. We've gone from tools for disaster resilience to research into ALS treatments, to the different ways in which connecting research outputs and research identifiers supports interoperability and visibility and, gathering information about research impact. And I really would like to thank all the speakers for highlighting how open, essential research infrastructure such as DataCite actually supports this and enables such diverse use cases. I remind everyone that you can share any questions that you may have in the Q&A. Just before we move on to that, I would like to highlight some of the ways in which you can get involved with us. So if you're not a part of our mailing list, please take a moment to sign up. We'll post a link in the chat, and this is where we share essential DataCite information, including our newsletter and events, but also service updates. And we're also running a community survey for members and non-members alike. Please help us share DataCite future by sharing your thoughts and feedback. It only takes a few minutes and it helps us align with your goals and priorities. And you can do so before 1st December 2025. So getting back to the Q&A session, I would like to perhaps pose the first question to our speakers. You've highlighted how DOI registration supports your use case. Could you also perhaps share what being part of the DataCite community means to you? Who would like to take this first? Felipe, I can see you went off mute.
I can. Oh, is
Okay.
No, please go ahead. Go ahead. I'll go second.
So for us, it's been really terrific because we are a nonprofit. We're not in academia. We collaborate with academia, but we are not around other groups that are doing this and doing open science, very often. And so it has meant a lot to us to benefit from the culture and the other materials around open science. In addition to being able to make the DOIs, it's been, a larger educational experience for us. And it has helped us using the tools that DataCite provides and the educational materials has helped us to explain the importance of this kind of as ambassadors of open science throughout the ALS research community. So it has benefited us greatly in those outreach efforts.
Thank you. Anything to add from anyone?
Okay, I'll go second. We see DataCite and this community as our window to the world. And as I mentioned just before, when you're a small organization, you focus on content. But if you want to scale up and you want to be a participant in a broader community, right? You want to work with UN, you want to work with the World Bank, or what have you. You need to standardize your data, your processes. You need to get serious, right? So being part of this community and having our standardized data and make it findable and interoperable, right, with the standards and the DOI will definitely help us to be seen as a very serious institution that takes things seriously and wants to be part of something bigger, right? So I would put it as like that.
Thank you. Bessem, do you have anything to add?
So I agree totally with the opinion of my colleague. One thing I want to add that DataCite is not only an open science infrastructure. It's fostering open science and collaborative way with international community. It's we exchange experience. We have feedbacks from each other community over the world, and it's a very benefit for us to learn and to adopt best practices in implementing open science in a fair way and with such a global community.
Thank you. We've got a question addressed to Felipe. How the impact of the data sets managed and reported regardless of DataCite Commons example make data count embedding reference is interesting, they note. Do you want to take that one, Felipe?
Okay, just let me read it again. Okay, so how the impact of the dataset management and report regardless. Okay. Yeah, I mean, I think that the impact, right, it's proportional to on, I would say, two things. It's proportional to how well your data is structured, regardless of you using the data set or not. I mean, if it's a poor data set on its own, it will do nothing. And as well, you need to be visible, and you need to be findable, right, and accountable for what you do. So I would say it's very important to have these two sides of the coin, right? To be to be complementary to each other, right? So what we do is when someone sends a data set, we first review it, right? And we work with it, we curate it if necessary, if needs be, and then we make it visible. We just don't take everything we get our hands on. We make sure that it complies with a certain standard, and then we make it visible. So when you make it visible, you make something good visible. I mean, I'll take just a little what do you call this? Like a mundane example. If you want to show off your car, you clean it first, and you take it out to the car wash or what have you, and then you show it off to your friends. So you have to do this work internally first, and then you go out on the world to show what you've done.
Thank you, Felipe. If we have any other questions, please let us know. Otherwise, I also want to take a moment to thank all our speakers. This was a fantastic showcase of what is possible with open metadata and persistent identifiers. And I would like to thank you for your time, and also to all of our participants today for listening to us and sharing your questions. Please don't forget to keep in touch. And we hope to see you at another event. Thanks to everyone, and goodbye.
Goodbye. Thank you. Thank you very much.
Thank you so much. Have a good day.